You're watching Medical News Network, your trusted source for the latest in the medical and dental information you need to know. I'm Mike Wittgenstein, and thanks for joining us. Today, we've brought our cameras to beautiful San Diego, California, to the offices of Dr. Valencia Luckman and Mark Bowers, to find out just how these two dentists are changing life in San Diego. Whether you snore, can't sleep at night, have a horrible smile, or just want to be better educated, my advice, stick around, get comfortable, and I'll see you inside. Hi, I'm Mike Wittgenstein with Medical News Network. Oh, thank you. Dr. Luckman.
Hi. How are
Very
you,
nice
Mike?
to see you. I came today, first of all, I want to thank you for allowing me to bring our crew out and to spend some time with us and interview us and educate us. Now, today you're going to talk to me about sleep apnea and snoring and breathing issues. And then your partner, who we're going to get to meet later, Dr. Bowers, is going to help me understand implants and the bite.
Right.
I want to start with a question that I know everybody's going to know the answer to. Dr. Bowers and you are married, for lack of a better word.
Right.
How does that work in the practice? I mean, how did that come to be? Did you start your practice together?
Yes, we did. Yeah, and it's working wonderfully.
Now, does it help that, I mean, that you kind of both practice different areas or different philosophies? Does that give you, I don't know, a better insight into the whole thing? I mean, normally when you go to a practice that there's more than one doctor, they all do the same thing.
Right.
So they all have only one little focus on one little
Right.
thing. Mm-hmm. Do you find does it help you and Dr. Bowers both in your practice that you both specialize or look into two different fields?
Yes, it does. Yeah, we each have our own areas that we spend more time in
And you share the information. You don't get mad and yell at everybody. No pans flying down the hallway.
No.
Okay. Now today you're going to let me introduce me to some patients. You're going to let me hear their stories, and you're going to talk to me about why I would go see a dentist, which I would never think to go see a dentist for snoring. Now, is this something new in dentistry? I mean, has it been?
Well, the problem's been around for a long time, except it's fairly been underdiagnosed, greatly.
Well, yeah, but normally for sleep, you go to a sleep doctor.
Right.
I mean, dentistry, and it makes sense. You explained it to me. I mean, dentists deal with the mouth. But do you think mostly people don't go because they don't know that that's what a dentist
Right,
does?
yeah, they don't know.
They're just uninformed, and so today
Right.
you're going to help me inform them?
Right.
All right, take me and show me around your office.
Okay.
Dr. Luckman was treating my son. She was his dentist. And then she noticed some discoloration on his gums, and that's when we started researching the sleep apnea. And as we did the paperwork for the sleep apnea for my son, I noticed that all the questions were pertaining to me as well. And she started researching and investigating sleep apnea for me, and I have it, I guess, a moderate level. So we're going to be looking at an oral application to get that fixed.
Stephen's case is pretty typical. A lot of adults either make excuses or just take it for granted that life is supposed to be that way, where you're tired every day, and some people think it's just age, and eventually you get high blood pressure or this or that stress is the culprit, and so they try to medicate themselves in other ways with painkillers or treating a lot of the other symptoms and not really going straight to the root cause of their symptoms.
Now, when I came earlier, I was talking to you about dentistry and snoring and sleep, and I told you I wouldn't have thought of that, and, was it something new? And as you explained to me, I realized it makes all the sense in the world. Your mouth, your tongue, your snore, your sleep, the dentist. But I know that if I go to a sleep lab, if I go to a medical doctor, they wire me up, they do all these tests, and then I see these things on TV where it says you just buy something and bite into it and it works. What kind of technology do you use to diagnose sleep apnea?
Well, let me show you. Mike, this is the rhinometer, and this measures the nasal airway and shows us the volume and the size and if there's any blockages in the nasal airway. And in fact, you might hear some clicking when we get started.
Okay.
And let me show you how it works. Okay, so what you do is we just place this right by the nostril, and then the patient can just breathe normally. Go ahead and breathe normally. Okay, it'll show us basically where the volume, if she matches up with the normative standards, and if she's within the standard deviation, her nasal passage is normal, and if there is a drop in this graph, then basically it will show us that there's a blockage in the in the left nostril. Otherwise, we check both sides. It takes about 60 seconds per nostril. Now the next thing we use is the pharyngometer, and this uses the EchoVision technology to basically measure the size of the airway and the opening and the stability of the airway. We diagnose and treat and document at another level, and we make sure that when we fabricate oral appliances for our patients that it's working well. First we make sure that the diagnosis is accurate and where the problem is coming from, and potentially, it could be from the soft palate, it could be from the uvula, it could be the tongue, it's an anatomical disease. So anyways, this machine will allow us to, with the patient just comfortably breathing through it, takes about 5 to 6 minutes, and we can map out her airway. Let me show you how it works. Okay, there you go. Are you comfortable? Mm-hmm. Okay. You can breathe normally. All right. And that's it. And now with this information, we're able to see all the way down her airway. Right here is where her oral cavity is, and we can see a rise there because the passage has opened up, and then right around here is where her tonsils would be if she still has her tonsils, and it looks like she does. And we continue on back to eventually to the back of the base of the tongue, way back here. And at this point, we really don't need any more information because this is the area right here is where it's critical to see the collapsibility of the airway. At last, we have the Embletta, and this is basically the overnight home sleep study that that patients can just take home with them in the comfort of their own home, and it measures what's going on with them while they're sleeping. They don't need to go to any hospital and get strapped up in a strange bed with people staring at them all night. They actually get to go home, sleep in their own bed with their spouses or whoever, and in the comfort of their own home, to be able to get as natural and accurate of their normal sleep as possible. And in the morning, you just bring it back, and the same physicians that evaluate the sleep studies in the hospitals are the same ones that evaluate the results of these studies. And the value of that is that you can get the same level of care here as you can going to the hospital.
The at-home sleep study was pretty much like an iPod-size device, and you had a finger device, then you had a couple of sensors, and it just read pretty much how you were breathing and sleeping at night. If you slept on your front, back, sides, and how many episodes you had per hour. And I actually had 24.5 episodes per hour where I stopped breathing. So it's pretty significant.
Dr. Luckman's, a pleasure to deal with. First of all, she's very knowledgeable. She, like, Dr. Bowers as well, always explained, gave me the reasons why I should consider embarking on a program to realign my teeth even at my age.
Yes, she's a sweetheart. Very much, yes. Most people hate coming to the dentist. I love coming to the dentist. I do. She's very nice. She always makes sure I'm comfortable when they're doing the cavities. And even, the Invisalign hurts a little bit, at first, but she always makes sure I'm comfortable. All my questions are answered, and, on the very first page, she had me fill out, what am I expecting after all this is over? And I said perfection, and she's like laughing, and she's like, well, hopefully, and she makes sure it's perfect. I love it. Yeah. I mean,
everyone, there's 5 of us, me, the wife, 3 kids, we all come to this dental office. The 2 older ones, like I said, had braces. Andy's seen for normal dental work, and now the sleep apnea. And now that I'm retired, and I could not have to go to the Marine Corps doctor, I'm coming here also.
So now, what you're telling me, most people that go and get diagnosed with sleep apnea or a sleep disease get one of these, all sexy and stuff. I mean, I can't, like Darth Vader, oh, hey, honey. And roll over at night. I tried to wear one. I rolled over, it about broke my nose. I understand that this is what you get. And you're trying to tell me that instead of this, I could have this. With your machines and your calibration, you can accomplish for most people with one of these.
That's correct.